Dr. Norman Swan is the presenter of the RN's Health Report and the ABC's popular Coronacast. He joins us now. Norman, always great to see you. So will this have a huge impact on our vaccine rollout?
It'll have an impact, but probably in the long term, not a huge impact, although they could start blocking our Pfizer supplies as well, because we've got 20 million doses of Pfizer due in the country over a period of time. Be interesting to see what happens to New Zealand. New Zealand's now, I think, got exclusively Pfizer, and they've booked another 8 million doses of Pfizer. So New Zealand's in an interesting position as well. So we just need to watch that and see how it goes. We've got Astra being released. As we said last week on the show, Pfizer is really important for our border workers, and it should be given to their families. It's only New South Wales that are giving it to their families. And Astra will prevent the rest of us getting severe disease. I don't think they're going to make the October deadline, largely because the Astra vaccine is 12 weeks apart, and that means it's going to take a while for the second doses to flow through the system.
Okay, so you believe that October deadline is unachievable?
I think it is, and that's probably the biggest reason. I suspect that it'll be slower than everything happens slower than you think. Getting general practices on board, there's a lot of grumbling from general practices, and some will fall by the wayside. It's just going to take a time to ramp up, but once it ramps up, we should be able to do it. America, without a coherent healthcare system, doing 2 million doses a day. Proportionately, we should do at least as well as that.
Norman, we've talked on the program about how you've said, don't go to Facebook for your news, talk to your GP if you've got questions. But then we heard from the GP Alliance basically saying, we don't have time to have lengthy conversations. Do your research before you turn up at the doctor's surgery. What did you make of it all?
Well, I just don't think that's particularly valid. It may be a problem with time with GPs and doing the immunisation, but they've got to take informed consent and they've got to explain things. And that's the responsibility of the physician who's there on duty when the vaccine's being done. So I just don't think we can shirk that responsibility. People should be doing their own research, but it's not necessarily easy to do, and there's a lot of misinformation out there, and really the most trusted person is the patient's general practitioner. The general practitioners and pharmacists are amongst the most trusted people in Australia. We journalists are down at the bottom.
Yes, sadly. Hey, before you go, let's look at the situation in Europe. There's been a lot of optimism about, as we've all seen those curves start to fall, but as restrictions ease in so many European countries, there is a fear, Norman, isn't there, that COVID will surge back?
Yeah, third wave coming back. Italy's seeing a surge, Germany's seeing a surge. America is still at 60,000 cases a day. It's not gone, even with vaccination. Israel's showing remarkable reductions, and Britain is showing remarkable reductions in hospitalisation and deaths. But the vaccination is yet to kick in, and we've got the new variants coming in as well. So they've got to hurry along, and you can understand why Europe wants to keep doses for itself. They really need them, but we need them too to protect our borders.
Norman Swan, great to have you on the program. Thank you.
Always a pleasure. Bye.